And Avik, a quick question I have is, how do you think organizations should embark if they haven't started yet for virtual trials, they don't have any solution, and even they haven't thought, but how can they embark on virtual trials now if they want to technologically?
Right. So I would suggest, hybrid is a good way to go. It actually gives them a common middle ground where you don't risk everything saying that 100% virtual. At the same time, you don't take the burden of doing everything 100% centrally at coming to the hospital. So midway actually helps in a big way to at least get started, right? Get over the hump, right? Do 2 visits remotely, 3 visits, or incidents remotely, right? So that's how I think organizations should get started. But I think it's a mindset to adapt to the new normal, to be relevant in the new normal. You don't have much choice but to embrace technology and embrace virtual trials and get the benefit of that. I also hear in the industry that many of them are actually doing smaller pilots, and the thought is that it is only for smaller trials, right? Or only for certain types of trials, dermatology, for example, right? I can take, picture the skin rash remotely from home. I can send it, and they can analyze it and stuff like that. Doctors can look at it, give the recommendation, stuff like that. But no, I mean, I think, don't have to box yourself or limit yourself to certain types of studies, certain scale of studies and certain therapeutic area, studies, or even phases of studies. I mean, we did back in 2016, 2017 timeframe, early days of time. The term was also, gradually getting coined. I mean, hasn't picked up, momentum like it is now, right? So almost 26,000 patients across 5 countries, 6 or 7 different multilingual languages, 100% of the data collected from patient home. So, good technology can be very scalable as well, and adapt to the requirements of patients and requirements of the studies, and ensure that the study team is comfortable with all of that. And we have also, of course, done small 25 patient single site kind of studies, and that's, you'll see many examples of such. But the volume or the scale that I just mentioned are very limited. Right? They're not very many, and people need to think bold enough to be okay. These size trials can also be done virtually. So just wanted to let you know that yes, it can, and there are studies that we have supported in that size and scale and spotless, and many of these sites were remote, I mean emerging world countries as well, 0 data loss. Right, so that's another very big important thing, that getting to 99% data safety, security, and is one aspect, and getting to 100% with 0 loss is another paradigm. So that last mile is always the most difficult problem to solve. So once you're able to do that regardless of what the technology is, what the this bandwidth is, what the latency is, what the computer literacy of the study team is, does not matter. Whatever is collected will be available, and nothing will be lost in transit, right? So while you're synchronizing the data, the Wi-Fi goes off, right? Spot internet. Do I lose something? And how do I ensure that the handshake comes back exactly where it left before, right? So look, we spent a huge amount of our IP, we have multiple patents on filed to ensure good compression technology that to work in such difficult geographies as well. At the same time, ensure that no data loss happens in such So there are publications on the studies and in PubMed and PLOS Medical and several other elite journals of the benefits of what we did and how we did, and how the customers this is sponsored. I said called a triple drug program with 3 top pharma companies was involved together. So yeah, if companies want to get started in their initial ventures there. Of course, we can share a lot of our learnings in helping our customers in that journey and figure out